Hello, everybody. Welcome back to another episode of the Ramos Law Difference Makers podcast. It's me, your host, Dr. Jim Hoven, today with another incredible guest who's making a difference every day of his life. This is Dr. Chris Gubbels, and actually a good friend of mine. Dr. Chris and I have had many great conversations. I've had him work on me. I've seen his amazing clinic, how they do things, and you are going to love this episode. This is something that once you hear it, you're going to want to think about it. You're going to want to understand some of the concepts we talked about, and you're probably going to want to share this message about health, healing, things of structure, all kinds of things. What happens if you get injured? We're going to have a lot of great stuff to talk about today. So without further ado, Dr. Chris Gubbels with Square One Health, welcome to the show.
Thanks, Jim. And I just want to say thanks for having me on. And I've loved working with your guys' firm. We've done some work in the past, and someone that sees patients that are injured, you know the value of working with high quality attorneys. But I also really excited to be here because, like a lot of your audience, I've also been a patient in my life. I injured my neck when I was wrestling in college, and I went down that path of seeing different providers, and no one was really providing hope. And you go from being, like when you're that age as an athlete, you think you're invincible. And then when you actually get injured, it can be a really scary thing.
Yeah.
And that's actually how I became a chiropractor.
Is it really?
Yeah.
That's such a common story, Dr. Chris. I'll tell you, I know that was my story too. I got hurt playing football in high school and ended up hurting my neck and went to a chiropractor. And I thought, wow, this is how I want to spend my life helping people, was learning this art. Is that how it worked out for you then? You're wrestling and then you got injured?
Well, when I was doing my basic bachelor's of science, and I thought I was going to be a trainer. But then when I looked into being an athletic trainer, it's not really, it's a lot of hours. You don't get paid that much. And I really didn't have an interest in seeing if I could make an athlete just perform a little bit better. But what happened was when I was hurt, I went through the regular system. We did physical therapy. I always say they cooked me, they electrocuted me, they froze me, so they gave me heat, they gave me stim, they gave me pain meds, worked with the trainers, and nothing was helping. And my coach was like, I want you to go see my chiropractor. And they were completely against it. They're like, no, you're not.
The team,
the
training staff,
the training staff was like, oh, it's a waste of your time, this and that. And I'm like, well, everything we're doing is not helping. And I mean, I was hurt pretty good. I couldn't really put a shirt on without someone's help. I mean,
what happened? Did you hit your neck on the mat or something?
Well, what happened was, and I remember it because we were a really good wrestling team. We were like 8th in the nation at the time. I was very competitive, and I just cracked the varsity lineup. And I remember I was basically doing what's called a Granby roll, if anyone knows about wrestling or martial arts. But I got stopped halfway through, and I basically got kind of pile drived. And I knew something happened. They stopped the match, and I was pretty sore that day. But I didn't realize the extent of it, like a lot of times when people are injured. But the next day, I remember laying in my bed, waking up, and I couldn't lift my head up. It hurt too much. I had to literally grab the sheets and pull myself out of the bed. And went to the training staff. But I had what we call, it was basically a buckling injury where the spine had given out. It damaged some of the ligaments, and it caused some problems in my upper thoracic spine. But once I was referred to a chiropractor, I went from barely being able to get dressed on my own, couldn't train. I was way over my weight class at the time, to literally competing 2 days later.
Wow.
And it was just a matter of knowing that right provider. But
did that change the minds of the training team, watching you go through that and having that thing? Did that open their eyes, or did they say, oh, you would have got better anyway?
I think they pretty much overlooked it. But the interesting thing was 4 people that I wrestled with in college ended up becoming chiropractors.
Really? Did you guys all go to the same chiropractor?
I think most of us did because there was a connection with our coach, but it was just understanding that different providers have different specialty, and there's things that one person can provide that someone couldn't. And how we look at it now, if they would have worked collaboratively, the results would have been much better.
I agree. It's so funny that you say that. I remember in some of the work that I was doing when I was in full-time practice, I got my diplomate in sports injuries. And so I was working in different venues outside of my office. So doing some sports injuries in my office, but a lot of, whether it be multi-generational care for wellness or car accidents, work comp, whatever. But man, on those sidelines, the best sidelines were the ones where we all had our role. So I did the manipulation side or some of the exam work. We had an ortho, we had a trainer, we had a PT, and everyone knew what they did. It was those well-oiled machines where the athletes, I think, got the best service.
Absolutely. And then I'll tell you more recently, even that's kind of how I got into chiropractic. And I think I always had a thirst for knowledge. And what led me to some of the things we do now, and one of the reasons I want to be on here is a few years ago, I actually was in a collision skiing, and I had a pretty bad damage to my clavicle. It was actually broken into 3 different bones.
And that's a collarbone for people who might not be watching, or if you're not heard that term, the clavicle is your collarbone. So you had a 3.
So it's interesting. Yeah. When they they don't always do surgery on your clavicle if you break it. But when I was up at the Vail emergency room, the doctor said there's 3 things we look at to see if you're a candidate for surgery. He goes, 1, if the bones are overlapped, like it's not a clean break. The second thing, if it's comminuted, meaning it's broken up into fractures, multiple pieces. Or 3, if it's at an angle, the fracture, so it can slide over. He goes, you have all 3 of those.
Oh.
Because we need to do surgery now. And the bigger concern is because your collarbone's what keeps your shoulder in the position. And as a chiropractor, if you don't have a shoulder that works, you're out of a job. Right?
Yep.
And I remember after the surgery, I knew I had some soft tissue injury, which soft tissue injury, that's much more damaging long-term than if you break a bone. And I remember going to the PA saying, where do I need to go for rehab? And at that time, as far as shoulders were concerned, I was just kind of a generalist. I knew general stuff in shoulder. And he said to me, well, you know what to do. And I said, no, I don't. Like, I need to go to the guy. Mm-hmm. I need an expert at shoulders. This is my livelihood. And I remember going to a physical therapist and working with him. And I just stopped and said, do you know what you're doing? Like, are you the guy or are you an average Joe? Because I need to go to an expert. And I think that's when you've been on that side of it, you can put yourself in a patient's position when they're hurt and they're looking at different providers and trying to, you understand the frustration and maybe the uncertainty of trying to find a provider that can really help you, that has the expertise.
Yes.
My wife recently was injured in a car crash, and she's an orthodontist and she looks down all day. And I remember her saying to me, she's like, if I didn't have you, like, I don't know what I would do.
Yeah.
And I was thinking the same thing. So I was actually at a seminar working on professional speaking, and I was thinking about my wife and her being hurt. And I thought, if she didn't have me, knowing what I know and someone that could direct her to experts within this field, like, what would her future be like? Just knowing how these injuries could potentially be lifelong.
Yeah.
And that's when I texted you. I said, Jim, I got to be on your podcast. I have things to share. And so I hope we can give some things of value. And I want to make sure when we're done that we can give some of your listeners things they can do that can help them, specifically if they're in a crash, things that maybe they don't think about. So before we're done, I hope we get around to that.
Oh yeah. Count on it, man. Count on it. You said something a moment ago that really piqued my, not my interest, but my interest of your story. And that is, again, I've known you for years now, and I know your personality as far as you have this really big drive to know and to understand and to execute. And that's different in different kinds of, we see it in all professions, but we also see in professions where no matter what it is, whether it's a doctor or an accountant or an attorney or a coach, where they want to do the job, but they want to do it at a certain level. And there's nothing wrong with that for certain levels of things. But when we're talking about injured folks, to have the degree of persistence that you have is amazing. Have you always had that, as far as that? Because you are a research, I'll call you a research nerd in the best possible way. Like, I ask you, right? I call you and say, hey man, do you have any papers on this particular thing? Has that always been your nature, or did you fall in love with the medicine and then that's what you turned into? It's
interesting. It hasn't always been that way for me. Actually, when I was a kid, I remember when I was in second grade, my teachers told my mom and my dad that they should just hope I could be a C student. Like, that's the best I would ever be. And it was just transferred from my mom's like, that's it, we're out of here. Brought me to a different school. Within a few months, I was in the accelerated programs, right?
Wow.
It's just, and the thing about it, when I was probably always a B student all the way through, even through chiropractic school, because I didn't have a purpose behind, like studying to pass the test was not purposeful to me. It didn't have reason. But I realized, and there was a doctor, maybe you've heard of him, named Dr. Scott Donkin.
Yes.
Famous for a book called Sitting on the Job.
Scott's a really good friend of mine, actually.
Yeah, so Scott was one doctor that I had talked to when I was in school. And when you go to school, whether it's to be a medical doctor or a chiropractor, or probably any profession, there's all these subspecialties you can become an expert in. And Dr. Donkin was an expert at basically workplace ergonomics. And I kind of started down that path. And interestingly enough, it was valuable, but it wasn't really inspiring to me. And so I asked him one night when I was at a seminar and he was there, and I was out to dinner with him and some other doctors, and which is always a blast when you're still a student. And I asked him, I said, with all these subspecialties, like, how do you know where to go? And he told me something that when I thought about it, I think it guided me to what I want to do. And he said, pay attention to things you naturally have interest in, things you will naturally just read on your own, things that, you're not doing because someone's making you, you just do it because of interest. And he goes, and do that. And when I was in school, it was learning more about wellness, and I'm going to Dr. James Chestnut's program and learning more about how people can be healthier. But I think throughout practice where there was just, I think I was blessed to have something I had passion about, because there's no effort when you have that natural drive. And I remember one time I was talking to one of my colleagues, and when you're in business or whether you work, there's always ups and downs. And I said, just be grateful for that you have something that you love to do, that you naturally have interest in, because a lot of people don't. So I think for me, it was just finding the thing that I have natural passion for that kind of drives that internal interest in learning more. And people are coming to you, you want to have solutions.
Yes.
Because I had been in their shoes as a patient, knowing, like, if someone comes to me and, when you become really good at something, or you have a good knowledge in something, you see people that come to you that have went to a lot of different places trying to get help. And maybe they didn't get some help, but they didn't get the best help. So for me, if someone's going to come into my practice and spend their time and energy and their money, we better have a solution. And for some of the things we do, I tell patients sometimes there's literally nowhere else to go.
Right.
So you have to get it right. So if you have the solution, or you can provide help, then it makes doing the things that are necessary to grow a business easy, because you're almost unethical if you're not growing, if you do have solution for people.
Yes. Well, one of the areas that you have a specialty in that I am fascinated by as a fellow DC, a fellow provider, a colleague, is scoliosis. Scoliosis it's a really crazy situation for people that have it. And a lot of people have it at a very minor degree. So for people that don't know what that is, scoliosis is where the spine curves. It has abnormal curves looking at the spine from front to back. You decided you were going to go get trained just in scoliosis. I'd like to explore that as we use that as a launching point to go into trauma, but tell me the scoliosis story. How did you get involved in that?
Well, it was kind of dumb luck in a sense, because I do a technique called chiropractic biophysics, where you specialize in non-surgical spine correction. But within that, there's a completely different knowledge base on scoliosis. And I was just I had patients that came in with scoliosis, and I knew a little bit what to do, but I really didn't know a ton about it. And I decided, well, I have to do some CEs, so I'm going to go to this seminar on scoliosis. What I didn't realize is I was walking into a very high-level seminar. And within the first hour, I thought, I know nothing.
I'm in over my head.
And it's one of the instructor is one of my good friends now, and person we actually work with now on making custom braces. His name is Dr. Jeb McAviney from Sydney, Australia. And I remember he would, ask questions to the audience. And at that point, I was like, I am not raising my hand. Please don't call on me, because I realized it was something I didn't know. But then he went over some new technology and advances. And when I better understood, what scoliosis is, different ways it can develop, different types of scoliosis, I understood there's a huge need, and there's not a lot of people that really know how to treat this outside of surgery. So it was also a niche I knew we could do well in our practice, and we could help a lot of people, because there was no one. And based off of what I learned at that seminar, and looking back at other conversations I had had with so-called experts, I realized a lot of the so-called experts really didn't know what they were doing. So I saw the opportunity and I saw the need, and it was fun for me to learn that. So that's when I started learning how to do custom bracing. And then I can remember when in chiropractic biophysics, to do your advanced certification, you have to present a case that you have treated. You've shown that you can apply the technique, and then you have to present it to all the other practitioners at an annual research conference. It's actually very nerve-wracking. At the time, it was like 200 doctors, and they're basically saying, thumbs up or thumb down, are we going to give him a certification? And I presented my case, and we had an adult from Denver that drove to see me that had a severe kyphosis and a scoliosis, which is generally thought to be not correctable or improvable in adults. And he had a tremendous success. And before I was kind of walking off, and Deed Harrison says, get back here. He's the president.
Yeah, he's the head of that.
He's like the guy
group.
for spine research. He goes, you need to publish this case. And I had never thought about publishing it. And so I worked with Jeb McAviney, who is actually the founder of ScoliBrace, who we make our braces with. And he gives me a call one day. I remember I was on a ski hill, and I was getting on a lift. And I said, Jeb, I don't answer my phone a lot on the ski lift, but I'll answer for you. And he goes, do you want to go to France? I go, France.
Glad I answered that.
And he goes, yeah, your paper got published for a poster presentation at SOSORT. SOSORT is the International Society for Scoliosis, Orthopedic, and Rehabilitation Treatment. And I said, well, what does that mean? He goes, you are going to be showing your paper on the highest stage there is internationally for non-surgical treatment of scoliosis.
To all kinds of doctors.
Yeah, all kinds of doctors from all over the world. Medical doctors, there's surgeons, there's physical therapists, and there's chiropractors. So I went, and from there I got invited to do a World Masters course, which is like doing a master's in scoliosis. I studied like 10, 15 hours a week for 10 months out of the year to do it. But that's how I got on that path. It's funny, you make one connection and you meet another person and it just keeps going.
You know what I found with that? So true. When I'm right on my purpose or my passion, like you were talking about, when I'm doing the right thing, chasing where my heart is telling me to go, as long as I do what's in front of me, the next thing kind of shows itself. And that's why I just heard you say, like, you found this connection and then you did your work and then this thing opened up and then this opportunity and that led to that. Life is funny that way and I love it. It's beautiful. It's taking you in the scoliosis specialty. Do you use that still as its own thing? Do you still treat a lot of specialized scoliosis persons, or are you kind of a consultant for other providers that treat scoliosis?
We do, and it's good and bad. I mean, one of the hard things is it can be very challenging people, but there's a big need. For example, people don't realize, people think of scoliosis in adolescence, and that's a lot of times where what's called idiopathic scoliosis. Idiopathic scoliosis means we don't know what causes it, what triggers it, but we understand how it progresses. It's about 3% of teenagers have scoliosis. As we get older, though, we see higher numbers. We see about 10% of scoliosis or degenerative scoliosis in people that are around the age of 40. At 60, it's literally about 38% of the population has scoliosis.
And that would make sense, right? If you have any altered posture and then you add degenerative changes, then...
Yep, and then as you get older, these people, as you get older, the risk of surgery, the risk of having a surgery and something going wrong increases. A lot of surgeons don't want to do surgeries like fusions on people when they start to get osteopenia or osteoporosis, because when your bones get more brittle, you're not a great candidate to go in and start putting screws into the vertebrae. And so there's more people that are adults that have chronic pain, maybe some radicular pain because of a scoliosis. They really don't know what to do. And what has been shown, like some of these curves get about 1 to 2 degrees worse per year, but over 10 years, that's about 10 to 15 degrees, which is a big deal. If you can make someone a custom brace and they wear that 4 to 6 hours a day, the research has shown that we can reduce that curve progression from 1 to 2 degrees, or about 15 degrees on average over 10 years, down to about 0.1, maybe 0.2 degrees or 1 degree worse over 10 years. That's life-changing.
That's life-changing.
And there's no one else that does that. There's not a lot of treatments, things like chiropractic, physical therapy, massage. Some scoliosis-specific rehab can be helpful, but those things can be very good for reducing symptoms, helping you function better, and good for your overall health, but they have not been shown effective in slowing the progression of these curves. We know with custom bracing combined with custom or specialized scoliosis rehab or exercises, those can make a major difference, but not many people know how to do this.
Yes. So are you on a mission? Is part of your mission as we go? And I mean, I know where your heart is really taking care of people at all levels, especially those through trauma. Is there anything that you see yourself doing in the future to help educate providers so that more people can get into this life preservation side of scoliosis? Or is that something like, that's really cool, but no, I'm on a little bit different path at this point?
Everything that I have learned from other people that are in the field doing that. And so I would never take, if I have a friend that's an expert and he's giving me his knowledge and I've learned from him, I've had other marketing people say, hey, you need to take this and rebrand it and make a thing. I'm like, well, this is their material that they taught me. They're doing that. I'm not going to steal from someone else and pawn it off as my own. So in that sense, I don't have the desire to do that. However, a little bit differently, like when I look at like our practice mission, our clinic, our goal is to help people feel better, heal better, and ultimately live better without drugs and surgery. And that can combine a lot of different things. And so I think from a health standpoint, what I think there is, there's a really big need for places people can go to get really, really high level care without drugs and surgery, that can really help them live better. And that could be from different things. And there's a lot of places you can go, but I think there is there's not a lot of places you can go where like I am getting like the right thing, the best care. And so maximizing that, and then from there expanding, whether it's helping other doctors have more clinics or expanding our own brand, that's where my real passion is now. And it's hard it's a challenge, I say, and challenges are good, right? Because it's one thing to master something, right? And like, it's a lot of business owners, if you ask them like, what is something you've mastered, they can tell you, I've mastered this, I've mastered this, I've mastered this. Then you go, but the real question is, how many other people have you taught to now master that? And that's where I am at now, is trying to get other people within our clinic to master different things so we can provide that on a higher scale, those kind of things.
That's beautiful. Well, let's jump into trauma. Why trauma? Did you see a lot of cases coming in of people who had slips or falls or accidents or whatever, or was it after your ski injury that you said, oh my gosh, I really need to focus on this? Because I know then, just like you went and did the extra training for scoliosis, you went and did extra training for trauma, in particular the spine.
Right.
Tell me that story, how you got into that.
Well, this is a really good point, because a lot of people probably don't realize that if you go to school to be a chiropractor or a physical therapist or a medical doctor, you don't get trained in this field. You don't have general knowledge of what happens to someone when they're involved in a trauma, or how to look for injuries, or how to document them or diagnose them. And so you can't just go to any doctor, because a lot of providers don't really know they may be able to help you, maybe good at what they do, but to really understand what's going on, especially if it's a medical legal case and being able to document that is a specialty. And what happened to me is I started having patients that I just treated that were regular patients that would be in car crash and come in. And I would do some things, and then you start dealing with insurance and you realize there's a bit more to learn about this. There's a lot more to learn.
Yes.
And I also realized it was a big need. And I had talked to some different attorneys, and I'd say, what's your frustrations working with providers? And they all say the same thing. It's doctors that refer out, doctors that work with other providers, doctors that provide good documentation. And I thought at the time, well, I don't do those things. Right?
So you knew you had to up your
I
game.
realized if I was going to go into this field, I had a lot to learn, because you may be going to court, you may be able to testify, you have to know your stuff. And so I thought, if we're going to go down this path, let's get really, really good at this, know what we're doing. And then at that point, let's start opening our doors and accepting more people that are involved in trauma. And then when you get in there, it's like, there's never ending learning with this. And so that was my path, was just knowing if I was going to do that, I had a lot to learn to make sure I could serve people that came to see me properly.
What was some of the biggest things you learned with respect to the treatment side of care so for example, someone's listening or watching the show and they've been involved in an auto accident or a slip and fall, or something's happened. I don't know, maybe they slipped on the ice and hit their head. Who knows? Something's happened. And they'd like, okay, well, I guess I go to my doctor, my GP. Is there something that you saw as I'll just call you, for lack of a better term, a general chiropractor, GP chiropractor, compared to now a specialist chiropractor in trauma? Was there some big things that you're like, wow, I didn't know this when I didn't know this, even though I was licensed, even though I was taking care of tons of patients and I was doing similar things, there was a knowledge gap that I had. What were some of maybe a couple of things you learned?
I guess what comes to mind first is when I used to go out, and I still do, I'll talk to different law firms and just talk to them about cases they've seen. And if I had 10 people that were injured in Fort Collins, let's say, and I got their journal records from a general practitioner and a chiropractor, I can tell you the diagnosis before I've ever seen them in 90% of the cases, because the diagnoses are generally, they have whiplash-associated syndrome, they have neck pain or back pain, maybe they have a sprain strain, or they have a subluxation. That doesn't tell you what the injury is. You can't read that and go, okay, now I understand what's going on with the patient. And what I learned is you got to be able to connect the dots. So what a lot of providers are lacking is the ability to put the notes in a way that an insurance adjuster or an attorney or another medical provider can look at that and they can read it and go, I understand what happened to the person. I understand why they were injured or how they're injured. And I understand what's going on with them, what that means for their future, and why they need the treatment they do. That was lacking. It takes a higher level of understanding to be able to take complex things and make them really simple. Does that make sense?
Absolutely.
So that was one thing I saw, that a lot of people didn't really know what was going on. And the other thing is, There's the famous saying that, it takes a village to raise a child. And the longer you're in this kind of work, you realize it takes a team of providers to heal a patient. And as a chiropractor, you do what chiropractors do, and maybe you have some other things you can do. But you realize there's care that people need that's beyond your office. And I heard this story, and it's so true. You ever seen The Hobbit, the movie?
Yes.
And I remember there was one of the series where he has his ring called My Precious. Well, healthcare providers with people's medical insurance, what's called MedPay, is kind of like Precious. They don't want anyone to get their hands on it. It's like My Precious, like no one touch it. I want this. But you realize like people need to see lots of providers. And if someone's really injured and there's insurance, people are going to get paid for their service either way. But you have to get the patient to the right provider. So you have to know what injuries are going on. You have to know other experts. And so when I was getting going in this, the hardest thing for me was I had to find people I could refer people to that knew what I was talking about. And you learn that you need other people that are really good at what they're doing. First, they make you look good because you send them to the right person. But no one wants to, if you've ever treating a patient that's not getting better and not getting better, it's not fun for you or the patient. And so you have to make a network and a team of people, whether they're in your office or outside of your office, to help that patient. And when I think about this, when a patient's injured, I tell patients in the beginning, our goal is, like, your goal as a patient, if you're injured, should be to be in the exact same position you were before the crash, after the crash. And for a lot of people, that's not the case. 50% of people that are injured in car crash never fully recover. 50. 25% end up being permanently disabled, meaning that they have injuries that impacts their ability to do their occupation or job. That's huge. And when you understand that, if you have people coming in your doors to see you, you have an ethical responsibility to know what you're doing and to make sure that patient is served at the highest level, both in your office and outside of your office.
That brings up something amazing, Dr. Chris, in the sense that I think knowing the statistics that you shared, where up to 50% of people won't ever be the same as they were, especially if they don't make that progress in the first 6 months. Like
100%.
You got to get what you're going to get in that first 6 months. And that's why people getting treated right after a crash or as soon as possible after a traumatic incident is critical, right? Because time is the precious. Time is the ring.
It's critical.
So time and great care. When you see that, I'm sure you have to have some really important conversations with people about this time window and this lack of ability to heal after a certain point. And so these are something that we have to talk about, their activities of daily living. What are they going to do? How do they manage, given that, oh man, we're 6 months, we're 8 months, we're 12 months. Now things may not look the same for you. So being able to communicate those things to the patient as well is a big part of your job, right?
Yeah, and all those are very, very critical. And the way, just so people that are listening understand, when you have a trauma, your body goes through 3 different phases of healing. You get this inflammatory phase that lasts about 3 days. Imagine you sprain your knee, it swells up, your body's basically pumping blood into that area with all these growth factors and healing properties to kind of set it up for the healing. And then you have about 6 weeks, that's called the regenerative phase. So like, your joints are connected together by ligaments. Everyone understands, or most people understand, the ACL. That's a ligament that holds your knee together. When ligaments get damaged, they're made of collagen. Collagen is the protein that they're made of. For about 6 weeks, your body will actually lay down new collagen. After that 6, maybe 8 weeks, that's done. And then for the next 12 to maybe 18 months, it's called the remolding or remodeling phase. That'll start to get stronger. But the critical part of that is in the beginning. If anyone has had, think about this, if anyone's had a knee surgery, when they wake up from that knee surgery, or they've had surgery on an ACL, they're immediately putting that joint through passive range of motion. Absolutely. And the reason that is when you injure a joint, your body forms scar tissue. And you need to tell the tissue how to build and repair. And if you're not doing that by seeing providers and doing the right rehab or doing adjustments from a chiropractor to keep the joint moving, your body builds up scar tissue, and scar tissue it's brittle and it's weak. And you have that opportunity to heal properly in the beginning. And once that window is gone, it's gone. And statistically, if someone is still in pain 3 months after the crash, there's a 72% predictability that person will be in pain their whole life.
Man. So then it's a management game, right?
Then it's a management. Not saying they can't, but the odds,
right,
aren't great. So it is so critical. in the beginning, what you guys probably see, what you probably seen as provider. And what I hate to see is when someone says, well, I thought it would get better and it didn't. And then, you know, months later, they're looking for help. And it's like, you know, that golden window has passed them.
Yes. And like we talked about a moment ago, at that point, because we're all providers out there now, you know, being a provider is something that I have an honor to be, but it's not what I do every day. Right. Now I have different obligations and things that I spend my time with. But for someone like yourself that treats in the trenches every single day, you're seeing people who got in a car accident 20 years ago, and they're still paying the price. And for those folks, if anybody watching or listening has been in some sort of trauma, any kind, and for whatever reason didn't get complete resolution, whether they didn't go in for treatment or whether it was beyond the scope of the care that they got or whether something returned because it wasn't all the way done, whatever. Healthcare is a decision, and I want to switch this because I think it's important that people know. Healthcare is a decision that each of us makes as an individual. I can't rely on you, Dr. Chris, to make me healthy. You're my instrument of knowledge, of skills, and of tools. But at the end of the day, I got to make that choice, right?
Yeah, my wrestling coach always told us, he said, nobody can do your push-ups for you.
Oh, so good.
I love it. I say that.
So
nobody
good.
can do your push-ups for you. You have to put in the work. And you can have a perfect plan, but without execution, that plan is worthless. And so one of the definitions of doctor is teacher. Part of a doctor's job is to teach you what to do. Your job is to do it. And when patients come to see me, I just tell them, like, my job is not to help you win a litigation. My job is not to do this. My job is to help you get better. And your job is to be an excellent patient and do everything you can do to make sure that you're not one of those 50% that ends up being in chronic pain. And it's like go time when they come in, like you have to have that real conversation that with injuries you see, like this is what could happen. We're going to do everything we can, and you need to do everything you can to put yourself in the best position to heal. And
what do you do with people? Because I always found this, whether it's now on the legal side as I'm talking to our clients or as I'm acting as an ambassador for you or one of our other providers with a client, when you're saying, hey, listen, Jim, you got to do these exercises at home. And you ask me and I say, I'm not doing them. At the end of the day, like you say, I got to do my own push-ups. Is there a way that you found to help people understand or get it or make that switch from relying all inside the clinic? And that's why, just for people listening again, a lot of times you'll hear people say, oh, those providers just want to get paid more money. I could do all this stuff at home. But what we've found as providers, we love you, but we can't trust you as patients.
So it's very clear in the research that at-home rehabilitation plans are generally largely ineffective, and because people just don't do it. And when they come to the office, it's like, hey, there's no cop-out. You're doing it because you're there. It's like some people can be very effective working out by themselves, but a lot of people don't have that accountability. But if they go to the gym, they're like, well, I'm here with the group. That's where things like CrossFit and Orange Theory is so great. When you're there in that environment, you're just going to do it. So if they come into the office, they're there. They just do what I'm told to do.
And they do it right. They're supervised, because there's a lot of exacerbation of injuries that happen of people that do decide to work out at home, see something on YouTube, and then they just go ham and they do it the wrong way, right?
100%. And in our office, like everything they do is timed. We keep track of when they come in, what they're doing, and I know how long their rehab should take. And if someone walks in and they're doing their rehab and they're back to see me 5 minutes later, I know it wasn't done. And you don't get treated by me until you go back and do what you're supposed to do. And it's tough love, but maybe some patients don't like that. But I guess if I was someone that was hiring a professional to help me, because that's what they're doing, they're hiring you to help them. If I was going to hire a trainer to get me in peak shape and he's like, just do whatever you want, I'm not paying him for that. Like, I'm going to someone's going to make sure I am doing. That's what I teach my staff, is like, that is really caring for your patients, is taking the time to make sure that they're doing what they have to do. And that happens in the office. And the way I do it, and I know when they're not, because when I do re-exams, one of the most important things, you always got to do regular re-exams to make sure the patient's progressing and they're achieving their goals. But I have patients, at first I tell them, tell me what you're doing. I say, are you doing your home stuff? And they say, yes. Great. Show me what you're doing. I don't go over, are you doing this? I say, show me. And if it's deer in the headlights, I know they're not doing it.
Absolutely.
And that's from the truth. And they know I'm going to check up on them. And so that is kind of how we do it. But some people are not. And the other thing that, I don't know where I learned this, but someone told me one time, is you never ask anyone, or especially a patient, to do anything if you don't first explain to them why.
Yes.
And I can think of an example. We had a lady that came in that was injured. She wasn't feeling good. People are in pain. Like, it's reasonable to be upset and cranky. But if you're involved in a car crash and there's potential legal implications to it, you have to be detailed. So our intake is detailed, and it's not fun to do. And she was frustrated with it. But once I explained to her why I have to know that, well, first I said, well, either you fill this out or we sit down and I have to ask every word. And she was like, oh, I'm fine with that. But I wasn't fine.
Yeah, that's going to take so much time.
Busy. But when they understand why, so if you're asking someone to do something, they have to understand why. And then it's on them. And then the ball's in their court. If a doctor wants someone to get better more than the patient does, that's a problem.
Absolutely.
And if I see that in our office, if I want them to get the treatment or I want them to get better more than they do, that's probably a patient that shouldn't be in my office, because it's not really, it's not great. Or if they want to be there, it's like, fine, you can pay for as you go, but this is on you. We are there to assist you and to help you. We are not there to do everything for you.
Yeah. And, I think a lot of people out there love the results of coaching without being coached, right? And so when we can learn to know when to use a velvet glove with a hammer in it, where we can be soft and kind and encouraging and loving as a provider, but lay the truth down and help them, that accountability helps the patients. But I really think that all patients would like to have responsibility. They just have to feel motivated, like you talked about earlier, but they also need to be shown the right way to do things. And that's why I love the way that you guys have, set your operation up where people get shown, we'll call it level 1 exercise. Let's say they learn these 3 exercises because that's where they're at. Now, once they can do it right, now they do it at home. Now we see that. And now what they show next is the next level of complexity or intensity that now you can supervise, make sure they're safe. So now they can build, once they show proficiency, now they can build that in their at home. Now all of a sudden they've won. They're like, I'm doing this, but they know they're doing it right. You've given them the attaboy, the gold star, and now they have enough reps under their belt. It becomes part of their DNA, and now they start doing it. Have you found that to be the most successful patient?
Absolutely. And it's just like anything. There is do it yourself. There's do it with you or do it for you. It's like anyone that's ever, maybe you've watched some product demonstration, or maybe you're an entrepreneur and you're looking at some new business strategy. Go, here's how you do it. You can take it and you can do it all on your own. Most people know that's not very successful. Or it's like, hey, we're going to show you the strategy and we're going to work with you. And that's what we do, is we work with patients. There's things that we do with them. There's things that we show them do, and there's part they do at home. And then the other one is we do it for you, which like no one can do your push-ups for you. But those are some patients that we know, even if they fail to do their stuff at home, we know when they're in our office, we know it gets done.
Yes.
And that's kind of a fail-safe. But it's the do it with you process, where we're going to do our part and we're going to work with you and we're going to show you what you need to do outside of here.
And here's part of the do it for you thing that I really love. This is something that we use in some of our clinical applications in things that I'm involved with outside of Ramos Law, where we have some technologies that you can't possibly do yourself. You cannot do
100%.
it. And so the do it for you stuff that I think is beautiful that you guys have is some of the different equipment that you have, some of the different opportunities where the patient can get healing modalities or testing they can understand, because you have to have it done for you. That's the technology piece, right?
100%. So in our clinic, when we do things to reshape and remold the spine back to normal, we just have equipment that you can't have at your house.
Yeah, what would that be like? Like, just try to describe what that would be like.
If someone comes in, everyone may be doing the same kind of stuff, but everything is individual for each patient. So can I explain our process, what happens when someone comes in? It'll make sense. So if someone comes into our office, we're a medical clinic. We have chiropractors, we have nurse practitioners, we have rehab specialists, and we have a medical doctor that is our clinical oversight. When someone comes in, they're generally going to meet with a nurse practitioner that goes over their health history. They're probably going to be evaluated by a chiropractor that's going to do more of a spinal orthopedic exam, and they're going to do diagnostic tests. And in between, as a team, we meet and decide, like, here's our patient. As a team, how do we treat them? We get everyone's best opinions. And so you get that, everyone giving different insights. But within the office, there's things that we do. Like, we may have a decompression machine. Most people are not going to go out and spend thousands of dollars on a decompression machine. And then when we're doing the rehab, when you really understand, there are hundreds of possible scenarios or ways we may have to go about showing an exact person how to fix their specific things, because people's spines or injuries are different. And when you get down to like a real high level stuff, being able to identify that and knowing subtleties and how what one person has to do is different than the other person, that's where you're able to help people that most people can't. And a lot of places people go can get pretty good results, but everyone's kind of just doing the same thing over and over. When they come in, everyone's stuff is exact for their issues, and people just can't do that on their own or know how to do it on their own. And even as providers, I may know what you need to do. Sometimes I can't even necessarily teach someone how to do it until they've done it several times with me guiding them, because it can be real. Some cases are very simple and some get really complex. Like a scoliosis patient could be teaching them how to like do scoliosis exercises for their stuff. It can be hard for them at first.
Especially after a trauma. That's a game complicator for sure.
And if you're in a trauma, you have to be really careful, because there's things you could do to make yourself worse. Right? You have injuries, you have limitations in what your spine can do. So you may need to be completely rehab different than someone that doesn't have injuries to their spine. So it's just, there's part of that needs someone's trained eye watching. And then just some of the tools we use, people aren't going to go out and spend thousands and thousands and thousands of dollars to do this stuff at home and then have someone trained. Like if you want me to come to your house, I will do it. It's very expensive, right? You don't want to pay me to come to your house to do your stuff for you. That's why we do it in the setting we do.
Right. Now let's talk about something that you mentioned, because it's one of my favorite therapies, and a lot of people have not heard about it, and that's spinal decompression therapy.
Yeah.
It is something, those machines are very, very expensive, and they make a big difference because of the way that they take these axial tractions,
right,
and then they do it at different angles, and they help with all this information going back into the brain. Explain a little bit about what spinal decompression is, since you guys offer that in your clinic.
Well, you have your disc between the vertebrae, and the discs are, mostly water. They don't have a direct blood supply, and how they get rehydrated is through motion. And so what a spinal decompression table does, and you can target exactly how you're pulling on the spine, but it basically, to make it simple, it takes the spine and it tractions it and it relaxes it. It creates like pumping motion to the targeted areas to help those tissues or those discs heal and repair and get some fluid back in there. And it's great for someone that has a herniation, someone that has disc bulging, people that have arthritic pain. We have some patients that just do it on a maintenance basis because they have chronic issues, and it's the one thing that takes pressure off those. So basically it helps recuperate some of the spacing between the vertebrae, helps reduce the inflammation there, because when joints are inflamed, that's when they really hurt. And it's a great tool to basically get some pressure off the nerves, to make it real simple, to deload the joints.
It's so good. I love that. I remember we had a couple of those in our practice, and there'd be filled up all day with people just getting so much relief in combination with the other things. So I wanted to highlight that. I want to go into a little bit of stuff that people can do at home from a conversation like this. So let's pretend that someone has a low back pain. What would be a couple things that they might be able to do at home to self-manage, where if those don't work, I better take it to the next level, like core strengthening stuff? Any quick tips that someone could have for home management?
Well, two things. You always look at mobility and stability, and sometimes you need to have a specialist show exactly what to do based on your case. But here's one simple thing. When your low back is supposed to have a natural curve in there, like a curve that goes forward, we call that a lordotic curve. And sitting on your spine is like sugar on your teeth. It literally rots your body. We see more people that have chronic problems because they sit every day. If I take a person, it's kind of counterintuitive. You would think someone that sits at a desk all day doesn't really put a lot of strain on their body, but maybe someone's out digging a ditch or doing manual labor is tearing their body up. It's actually the opposite. The person that sits every day damages their body. And especially when we have these nice, comfortable couches, when we sit in there and if you kind of relax in, you lose that curve in your spine. So one simple thing you can do is, if you're sitting on a sofa at home, is take one of the corner pillows or a towel, roll it up, stick it behind your back, and that kind of helps keep that normal curve in your low back. That's like one simple thing that comes to my mind. The second thing is, every one of your joints is designed to go through full range of motion every day. Yes. You can Google something called CARs, which are called controlled articular rotations. And you can find it on YouTube. Just simply putting your joints through full range of motion every day is essential for your body. Your brain will actually work better, because when you stimulate your joints, it actually makes something called proprioception that recharges and shuts down stress in your body. So just putting your joints through full range of motion every day is one of the most important things you can do as you age, just to keep your current level of mobility.
Nice. And if someone decides to follow your advice and go look up some CARs or some full joint range of motion activities, is there a time limit or a rep limit that you should look at that? So for example, we have two types of persons. One of them would be like me that says, I do what I do in my workout, but I might not be hitting, especially if I'm not working on a certain joint system on a certain day, but I want to put some stuff into it. I'm willing to give 10 minutes into pure mobility outside what I'm doing. That's one type of person. The other type is a person that says, I don't do any exercise, but boy, what Dr. Chris said just makes sense about putting the brain or the body through every joint, full range of motion every day. How do they know how much to do if they decide to go chase that a little bit?
They're actually pretty simple and it doesn't take a lot. And I would say, one, if you have a problem area, you start there. If you're going to do a shoulder workout or something that involves your shoulders, do your shoulders. But or you could cycle it. Oh, today I'm going to do my hips. Tomorrow I'll do my neck if it really comes to time crunch. But it's not like you have to do 30 seconds of shoulder stuff. It's just putting the joint through range of motion a couple of times. So it's actually really quick. You could do your full body in probably 10 minutes, or you can say, hey, I'm going to work on my neck, my back, and you could isolate it and do it in a couple of minutes.
Beautiful. Do you have any thoughts as we kind of wind down here? Do you have any thoughts on the incorporation of things like here's one of the things I'm doing in my workouts that I love right now is Qigong. And Qigong is a form of movement, but it's a healing form of movement. Tai Chi, very similar, but Qigong maybe has a little bit different angle to it. When it comes to yoga, Tai Chi, Qigong, any of these types of real slow, intuitive, working through body motions, even something like animal flow, which would be a half beat faster than that. How do you like that as an integrative mobility therapy for ongoing or for pain management?
Well, I think it's great. I call it like floor work, or just mobility work. And as you get older, I think you get to a point where you're less concerned about how big and strong you are, and you're more concerned about how well you can move. And as you look at people as they age, if anyone knows who George Burns, he's a famous comedian.
Yes.
I heard him say one time that you don't get old and stiff. You get stiff and then you get old. So doing things that increase mobility like that are great, and I think it's an essential part. And for me, I have to realize today my workout is mobility. It's not squatting or whatever or doing CrossFit. It's like mobility is the most important thing now, and just knowing that mobility needs to be a priority as you age. And I would say maybe someday instead of going to the gym, you're doing mobility work at home, whether that's yoga or Tai Chi or whatever. It's like, just know mobility work is important. And if your overall goal is to function well so you can do things that are important, just use that as one of your workout days if you need to. I
gotta throw this in. I know I keep saying we're winding down, but man, I can't get enough of this. I could go for hours. I was listening to a podcast, and this guy was insane. And he's like the trainer's trainer. I think his name is Andy Gilpin, I think is what his name is.
Not familiar with him. I'm about to look it up.
You have to look it up. I'll send you the podcast.
Great.
It's really great. And he talks about one of the biggest game changers that he does with his athletes. So he's that real unique unicorn, very similar to yourself, where he's an academic and he's a practitioner. In other words, he lives it at both sides. So he's doing the research. He's actually doing the research, coming up with the papers. Then he's teaching it and doing it in his own life, but then he's teaching it to the highest level athletes as well. And one thing he taught the host of this podcast, who's a guy named Andrew Huberman, it's his podcast that this guy was a guest on. He said one of the biggest things that he has every athlete do is breathe at the end of their training cycle. At the end of their session, every single session, they take 3 to 5 minutes to just either box breathe in a 4 count where you breathe in for 4, hold for 4, breathe out for 4, hold for 4.
I've heard of this.
Yes, or you breathe in for a count and then breathe out for double. But by doing that at the end of the workout, it resets the nervous system so that you're not carrying the fatigue from the workout into your day, that it starts a new segment and that it will literally change the energy for your rest of the day. So I started doing that about 2 weeks ago. And I'm telling you, I do believe I noticed a difference in taking that 5 minutes to do that at the end of my workout. So just
kind
something
of reset.
Cool.
I like it.
Yeah, especially if you're doing a bunch of rehab in your office and people, if they're out of shape, just what they do with you, they could get winded from that, right? Like it's pretty powerful. Mm-hmm. Anyway, so dude, what a great episode. So how can people get a hold of you if they want to learn more about you, about what you do, about anything that you're about? How can they reach you?
Well, one, you can we're Square One Health in Fort Collins, Colorado. The second thing is you can follow us on our social media. I try to post regular things on there to give tips. It's just Square One _ Colorado. So follow us on there. But we are in Fort Collins, Colorado. Our clinic is Square One Health. But you got to let me give a couple of tips.
Please.
Okay.
Oh, absolutely.
So there's some things that you can do that decrease your risk of having a severe injury. Right? That people
prior
don't think
to the injury?
Prior to an injury,
okay.
Right? And these are things that you can control. And one of the simplest ones is when you get in a car, especially if you have different people using the same vehicle, is making sure that you have your head restraint in the right position. It should be within 2 inches of the back of your head, and you should have the top of that basically at the top. Because if your head restraint is low, or if you sit hunched over, you have a much higher chance of having a more severe neck injury if you're in a car crash.
Yeah, because what will happen is, and you can explain this, but for anyone who's not watching, who's listening to this, picture in your mind a fulcrum where if you get hit from behind and that headrest is low, your head's going to go backwards and it's going to go right over the top of that fulcrum, right? And extend everything in a real bad way. Is that what you're referring to?
Yeah, and even if you have it in the middle, if you get rear-ended, your body actually elongates. It's called ramping during the crash or riding up, and it can extend over that. So just making sure that your head restraint is close, or your head, it's not a head rest, by the way. People think it's a head rest. It's not designed to rest your head on. It's designed to restrain your skull and cervical spine from excessive shearing if you get rear-ended. So it's a restraint. That's why they're designed. So make sure it's close to the back of your head, and it's probably about the top of your head. So make sure that's positioned. Your seat belt. People don't think about this. You have something called your B-pillar. Seat belts are designed to be adjusted, and you want that to make sure it goes over your shoulder and your chest. And you see this a lot of times in kids. They'll take their arm and put it under their shoulder.
Yes.
Right?
Horrible idea.
Right. And the reason that we have booster seats is to raise kids up, because if they're sitting too low for the seat belt, the lap belt will go over their midsection versus their pelvis. And one thing with parents, and I know this is hard because I've seen it, like in our stepson, is like your kids want to lay down when they're tired. But what you'll see is a lot of kids that have fatal injuries because they're not positioned right. And if they're laying down, or if they have that seat belt under their body, first of all, if they're laying down, and that seatbelt's under their body can move any way if they're in a crash. If they're too short and they don't have a booster seat, that seatbelt goes over their midsection versus their pelvis, and that leads to a lot of lacerations in internal organs, and a lot of times they don't get detected. So for your kids' health, make sure they're sitting up. I know it's hard when they're tired, but it's for their health, right? And make sure they're sitting up. If they need a booster seat, they have one, and make sure they're wearing the seatbelt properly, because if they do get in a crash, that could make the difference, because a lot of times in the rear seat, you're the safest, and kids can be injured, but if they're in the back, they have less likelihood of being injured than the adults, unless they're not using their safety stuff properly.
Ooh.
So just doing those little tiny things can reduce the chance, if you're in a car crash, that you have less severe injuries.
Those are great tips, and that's great advice. And now I'm going to ask you for one more piece of advice. If you can think of it, what's the one single piece of advice that you've either learned, received, or have been given in some way that has helped you act as the centerpiece or foundation of how you live your life now, that you would share with us so that we can now take and apply it into our life?
Oh man, there's a lot of things. I think whatever your journey is, whether you're growing a business, where you're trying to get healthy, you're trying to accomplish something, that I think people generally overestimate how much they may be able to accomplish in a short term, and they underestimate how much they can accomplish in a long term. And one thing my wrestling coach taught me is, like, when we were trying to be national champions, he's like, do something every single day that gets you closer. And so whether it's improving your health, improving your relationships, whatever, you should know what your different areas of life you're trying to improve, but just do something every day to move forward, to take action, to heal better, to live healthier. Always do something positive. And there's things that, if you look at your health, maybe you make a bad food choice. That doesn't neglect making a positive food choice later. So start by adding good instead of trying to give things up. Add good things into your life, whatever area that may be. And it's a lot easier to add things than it is to give things up. And then just do something every day to improve or enhance or try to get 1% better in whatever area that is.
That is brilliant. That's like a mic drop, Dr. Chris.
Thank you.
So listen, what a great time. I'm so inspired. I hope that if you're in the audience, you're listening, you're watching, that you will take in this information and share it, right? Take it into yourself. What can you learn from this? But not only that, who that you know needs, not wants, needs to hear this. If they have an interest in it, fine, but there's going to be someone that you know that needs to hear this. So I would love it and appreciate it if you would send it to them. We just want to make a difference. Dr. Chris is making a difference. And until next time, you go out there and keep making a difference. Have a great day.